All right, everybody's in. Let's get the show on the road. Tonight, we have a wonderful guest speaker for you, Dr. Victoria Reinhardt. Go ahead and wave to them, Dr. Reinhardt, so they know who you are up there.
Hi, guys.
Dr. Victoria Reinhardt holds a Doctor of Pharmacy degree and is currently working as a consultant pharmacist with Manatee County Emergency Medical Services. She is also an assistant professor of pharmacy practice at LECOM School of Pharmacy in Bradenton. Now, some of you may have preconceived notions about pharmacists. You see them maybe when you go to CVS or Walgreens or Publix or Walmart. So I want to throw a poll at you here. First thing, right out of the bat, I want you to check your computer, make sure that you can see it. It's coming up. I want to see exactly what you think you know about a pharmacist. You should see the poll on the screen. The question is, a pharmacist does a lot of things. Which of the following is not something a pharmacist typically does? What do you think? Please answer that poll. I can't wait to see your answers. I'm watching the numbers go up as everybody's answering. We've got about 50% voted. About 80% voted, just waiting on a few left. Which of the following is not something a pharmacist typically does? I've got just about everybody in there. All right, I'm going to go ahead and end the polling. I'm going to share the results. You should see on the screen there, we've got about 10% says that pharmacists don't advise doctors on what dose is safest. 4% said pharmacists do not figure out which medications enter your brain and other organs. 2% say pharmacists do not identify medication side effects. 14% says they don't change medications based on lab values. 32% said they don't catch drug interactions. But the actual answer out of all those, the one thing that a pharmacist does typically not do is inject medications. Dr. Reinhardt, would you explain that to us, please?
Absolutely. First, I have to talk about how impressed I am with this group. You guys are really on top of it because this is a challenging question. So I don't know, we can all still see the question, Joan, or not?
No, I already took it off of the screen.
Okay. Yeah, so guys, there's a lot of different things that pharmacists do on a regular basis. We do frequently advise physicians on what the safest medications are, which medications enter the different organs of the body, like the brain or the kidneys or the liver, and how that might impact each of your organs. We do a lot of identifying medication side effects and then changing medications, either changing the medicine itself or changing the dose of a medicine based on your lab work. And so you guys are probably all familiar, maybe at some point in your life, you've had to go and get blood drawn and your physician looked at your blood work, or you have a relative that has to go and get their blood drawn for lab values. And based on the numbers of those lab values, pharmacists are frequently the ones that can change the medication to something that's safer or more effective for the patient. We also teach patients how to use medications. You all realize that we did that on a regular basis. That's the most common part of our job. And we also spend a lot of time for every medication that is filled at the pharmacy. We evaluate that medicine for drug interactions. So drug A and drug B don't always get along. And if two drugs are given together that don't get along, that can be really harmful to you or your loved ones, and can even result in hospitalization or in death. And so managing and evaluating drug interactions is a huge part of what we do. We don't typically inject medications, okay? So we prepare them in IV rooms, and we draw up medications, and we figure out the dose and the side effects and the drug interactions and all those things. We don't usually inject those into the patient. The exception to this is when you go to your Walgreens or right now with COVID, everybody's getting vaccines, right? And so the exception to this rule for injections is vaccinations. And so pharmacists widely administer vaccinations.
So wait a minute, Dr. Reinhardt, are you telling me that pharmacists don't just do what I see them do in Walgreens, and that's counting out pills and putting them in the bottle? There's more to it than that?
Tons more. So the average prescription, so every single prescription filled at your local pharmacy, or, when you go into a hospital, you have hundreds of prescription orders that, of things that you might need to get through your IV, or medicines that they might need to treat you with when you're hospitalized. Every single one of those medications, we evaluate. Some pharmacist back in a basement somewhere or behind the scenes or on a different floor is evaluating that medication order to make sure it's the right drug for you, that it gets along with your liver and your kidneys. They're evaluating to see if there's a drug interaction that's unsafe or could possibly kill somebody, right? We evaluate all of those things and make sure that it's safe and is going to be effective for a patient. So all of that is why pharmacists have to go to school to get a doctorate degree, right? So we do 8 years of college education in order to be able to do all of that and know all of those things to make sure that the medicines are safe.
Awesome, thank you. I'm going to launch a video, an introductory video, just to give us a little further of a quick background into pharmacist duties. Take me just a second to share my screen and my computer sound here. And Dr. Reinhardt, I'm going to look at you for the thumbs up to make sure that you can hear it when it starts playing. Here it goes.
We're pharmacists who are passionate about making your health a top priority because we're people who care about people. It means really getting to know you and mapping out the best solutions for your health. It's being accessible whenever you need us, wherever is most convenient. It's working with the other healthcare professionals who know you best to provide you with a top healthcare plan. It's using a vast knowledge base to give you advice on health issues extending far beyond medications, like detecting dangerous symptoms and suggesting timely interventions. We're here to help you live your healthiest life. We're your pharmacist. Accessible, knowledgeable, indispensable.
I'm going to roll right into my next video. If that doesn't have you hooked yet, if listening to Dr. Reinhardt doesn't have you hooked yet, wait till you see what's coming next, because pharmacists can be famous people too.
The catalytic decomposition of hydrogen peroxide is the chemistry demonstration by Camille Schreier, Miss Virginia.
Science is all around us. I've loved science since I was a little girl, and now I have the opportunity to pursue the career in science that I had always dreamed of. Science is a talent, and it's my mission to show kids that science is fun, relevant, and easy to understand. Now, you've probably seen a bottle of hydrogen peroxide, maybe when you had a cut and used it to clean out the wound. Hydrogen peroxide is a chemical that's breaking down slowly all the time. But have you ever wondered why it's packaged in a brown bottle? It's because the light from the sun speeds up its breakdown, so it's packaged in a dark bottle to protect it from light. But light and time aren't the only things that break down hydrogen peroxide. Catalysts are chemicals that are used to speed up reactions. And what we're about to watch is the catalytic decomposition of hydrogen peroxide. But be careful, don't try this one at home. Now in my flasks are concentrated hydrogen peroxide, food coloring, and dish soap. I'm about to pour in potassium iodide, my catalyst, which will start the breakdown. Now this reaction is very simple. It only produces three things: water, oxygen, gas, and heat. The heat is formed from the breaking of the bonds within the hydrogen peroxide molecule, and the oxygen gas is trapped in the dish soap, which forms the foam so we can see how far the reaction has progressed. Now the next time that you see a bottle of hydrogen peroxide, I hope you impress your friends with what you've learned, and keep an eye out, because science really is all around us.
Thank you, Miss.
Now, I don't remember them showing me anything like that when I had career day at school or anywhere along the line, or I might have made some different choices on my path. Oh, we've got some more students coming in here. We're going to get to the interview section now. I'm going to bring up the interview questions. This is where we dive more deeply into the career of pharmacists, but also into Dr. Reinhardt's path. How did she get from being a middle school or a high school student to where she is now? Share my screen again and bring this up. Dr. Reinhardt, is that visible?
Yes, ma'am.
All right, good deal. Everything's working like it should. We'll just start with question number 1. Dr. Reinhardt, can you please tell us what your job description is?
Yeah, so a traditional pharmacist job description is going to vary depending on what setting you're in. You guys are most probably familiar with what you would see at a Walgreens or a community pharmacy, in which case the pharmacist does the things that we've already discussed, right? So they evaluate all of the prescriptions to make sure that medications are safe and are going to work for what they're prescribed for, and evaluate for drug interactions, and of course, teach patients how to use those medications. So that's kind of the overall job description in that setting. There's other settings within the hospital setting, and we're going to talk about a lot of different other jobs that pharmacists can have. My role as a pharmacist, I work with emergency medical services or paramedics for patients who have called 911, and we're trying to figure out why they keep calling 911 and what the disease or medication problems are that are contributing to them calling 911. And so I'm the pharmacist that comes in and looks at disease management and the medications to figure out if I can stop this pattern of patients calling 911.
I didn't even know that existed. Well, that's fantastic.
It's very different. It's an innovative role, but I think that, we think about innovation and science and new ways to do things, and that's what pharmacists do, right? We innovate with medications all the time.
Wonderful. Now, where do you work and what is the atmosphere like? And then compare that with maybe other roles of a pharmacist.
Yeah, so my day is a little bit different working with emergency medical services and paramedics. So I work with, within their home base. And so we have an office that we work out of, but we see patients in their home. So my day at any given time, if I'm riding with paramedics, would be going through different neighborhoods and visiting patients in their homes, or at a local library or other location if we're meeting outside of the home. When I am teaching, so I also am faculty, and so you guys as students, you're well aware of what that would look like. And so I have a classroom and an office within the college for where I work. And then the atmosphere, in a community pharmacy or a hospital, very similar probably in some ways, fast-paced, exciting, lots of patients needing help, and lots of new challenges because there are thousands and thousands of medications. And so every single order that you process is a different way of looking at things, and you're using a different skill set in a sense. So where each pharmacist works is a little bit different, but definitely, a lot of unique opportunities depending on what setting you're in.
Absolutely. Now, you mentioned when you teach. Now, you teach at LECOM. For those students who may be on this call that have never even heard of LECOM, can you tell us about that?
Yeah, so LECOM is an acronym for Lake Erie College of Osteopathic Medicine. And so osteopathic medicine is a type of of medical degree, like an MD that you might, a medical doctor, when you go see your pediatrician or your physician. So an osteopathic physician is another type of medical doctor. And LECOM has a school of pharmacy and a school of dental medicine. And so they have a variety of different health professions. And I am faculty professor would be my title in the School of Pharmacy for the college.
And for those of you who are coming to us from Manatee County, LECOM is right here in Manatee County in Bradenton, right on the line there with Lakewood Ranch. So right here in our backyard.
Yes, super close.
What fellow health professionals would you work with as a pharmacist?
Usually pharmacists work with, of course, anybody else in the pharmacy profession. You have a lot of collaboration within your profession. Physicians and nurses are the next most common people that we collaborate with, because physicians and nurses do a lot of prescribing and direct patient care. And so whenever, a physician is prescribing something to treat a condition, they know that the pharmacist is the one to be able to make sure that it gets along with all the patient's medications, that the dose is correct and safe to start in that patient. And so they might ask our advice. Nurses work directly with patients. And so if, a patient is experiencing a new symptom, and it might be a side effect, then we can collaborate with the nurse to figure out how to, confirm whether or not that's from a medication and how to treat it if it is the result of a medication. So physicians and nurses are probably most common, but also social workers, like my role, I work with paramedics. We work with, epidemiologists and people from laboratory, lots and lots of different collaboration opportunities.
Absolutely. And not to mention the pharmacy technicians or pharmacy assistants that help out as well.
Mm-hmm.
What kind of patients do you work with as a pharmacist?
All kinds of patients. Everybody's a patient, right? All of you at some point have probably had either yourself or a family member that has had to, go see a physician for some reason or another. And so, I think that this question is better phrased around what type of pharmacist are you going to be, right? So if you're a geriatric pharmacist and you work with the elderly, and so you're going to specialize in patients that are 65 and older. If you're an oncology pharmacist, you're going to specialize with cancer treatments and medications and chemotherapy. And so your patients might all be patients that are suffering from some sort of cancer, for example. And so the type of patient that you work with is going to vary dramatically depending on what area of pharmacy that you're in. Your community pharmacists, they deal with everybody, right? All walks of life. And then my role, I work traditionally with patients that are more underserved. And so they often, have financial barriers or cultural barriers or don't have access to the same kind of care. Maybe they don't have insurance. Maybe they don't speak English. And so there's a lot of underserved populations that I work with. Those are the ones that frequently end up calling 911 because they don't have access to a physician on a normal basis. And so that's who I work with usually.
Yeah. Now, I bet you don't have any such thing as a typical day, but what might a pharmacist expect to be a typical day, or is there never a typical day for a pharmacist?
Yeah, I mean, there are some things about our job that are typical, right? Like we're going to review medication orders. And so whether that's in a hospital or in those orders are all IVs, through IV bags and getting administered through an IV, or whether that's in a community pharmacy, you have a common denominator that you are going to review the medications for safety and drug interactions and all of those elements. And you're going to do several hundred of those within a given day. No matter what role that you're in, probably. But there are definitely, every day is going to be different, right? We have a drug shortage that might mean that you have to, evaluate when drug A is unavailable. What do we do, right? Do we use drug B? Do we use drug X? What do we do to replace drug A if drug A is not available? And you have things like COVID, right, that happen. And the big question of 2020 was, how do we treat this disease and how do we lessen the death rates with COVID? And so pharmacists are on the cutting edge of being able to provide information about how this drug works, whether or not we have data on whether it's going to be effective for COVID or not. So all of these things, completely change your typical day. So some things are typical, and the skills that you use are pretty typical around, knowledge of medications, but the events on a given day can vary widely.
How many hours would you say you put in per week? And second part to that question, does this impact your personal life?
Yeah, so I would say that anybody in healthcare is putting in a lot of hours over the last year, right? You have pharmacy jobs that are standard hours, 40 hours a week. So you go in and you can work, 10-hour shifts or 12-hour shifts, and you work your 4 days a week, and then you're off for 3 days a week. You have pharmacist jobs that are Monday through Friday, and you're off on the weekends. Or you have pharmacist jobs that you can work Monday, Tuesday, Thursday, and have a couple weekdays to go and do things with your family. Or you work every other weekend, so that sometimes you do have free weekends. Anything in healthcare, I think, is going to interrupt your personal life to some degree, because people get sick on the holidays and people have car accidents on the weekends, and you don't get to decide when people get hurt and when people need you as a healthcare provider. But luckily, we have been able to figure out ways to schedule so that healthcare providers get several days off per week usually.
Right. We don't want fatigue for our healthcare professionals out there, that's for sure. What type of starting salary can a person expect as a pharmacist?
So pharmacist salaries range from about $50 an hour to $70-ish an hour, depending on what setting you're in and how long you've been practicing and things. So, if you do the math on that, you guys, I know you were all excited tonight for a pop math quiz, right? Should I have you do the calculations per hour per week? So that works out to be, probably right at around $100,000 a year. The money is pretty good for the pharmacist profession. I mean, it is a doctorate degree, so you have to go to school for a really long time, and a lot of times that can include a lot of debt and other things. But it's a very high level skill set to be able to evaluate these medications, and so the salary does reflect that expertise. So that's probably around where most patients, most pharmacists fall.
I usually like to take just a moment at this point when we get to the salary discussion, especially for those students who maybe haven't had that first job, haven't had that first paycheck out there, and taken a look at it and wondered where the heck did all their hard-earned money go out there. And especially when you compare, all right, minimum wage, they're moving that up to $10 an hour. Within 5 years, we hope it'll be $15 an hour. But after going through and getting your doctorate and becoming a pharmacist, $50 to $70 per hour, they earn that money in school and for all their skill set and the experience that they will bring to the job. Wonderful. Now, why did you decide to pursue this career path?
I feel like the pharmacy profession is the epitome of helping people. So you have people of all walks of life, right? Depending on what area you practice in, that they need help. They are sick and they need treatment. And you can help them understand how this treatment works, how to use this treatment, and how to empower that patient to get better. And so it's the epitome of helping people. And if you like to help people, then it's definitely, a profession that I would encourage you to explore. I also loved science, and I also love puzzles. I'm a little bit of a nerd, guys. So I love to figure things out. And I know that, there's 60 of you here tonight. And you're not all going to respond the same to a medication, but I can figure out, exactly how Maxwell is going to respond to medication A, or exactly how Sydney is going to respond to medication B, and maybe which of those is the better option for each of them, right? And so it's a puzzle for me that there's the best medication for each patient out there. And that's what also drew me, right? So helping people, figuring out puzzles in optimizing medication therapy, loving science, those are all things that drew me to this.
How early did you know what you wanted to be when you grew up?
Oh, I didn't know. I was an accounting major in college. I was going to go be an accountant, do people's taxes, because that's another puzzle, doing taxes.
Yes.
You'll find that out when you guys are in a
Oh, yes.
first jobs. So yeah, I didn't know. And I was waiting tables in college, and a pharmacist sat in my section. How many of you have a job right now or have ever waited tables? Anybody?
Raise your hand if we can see you out there.
Yeah, I can see a few hands. So yeah, so when you are, waiting tables or working with the public and in customer service, I love it. You guys are raising your hands. I see you. You have to, prioritize people who are waiting. You have to have a good memory about all the different things that are happening at a given time. And a pharmacist came in while I was waiting tables and said, "You seem to be good at a lot of those things. Have you thought about this?" And that's history.
Wow, that's a fantastic story. I like that one. Did you happen to face any challenges on your career path?
Sure. I mean, the degree itself is the biggest challenge. It is long, hard work to earn a doctorate degree, and it's something that you have to really dig deep into. And it's about goal setting, and so I think that degree is the biggest challenge of, through all the things that happen, you're going to get jobs and contribute to your family's income, and you're going to move possibly in your life, and you're going to have boyfriends and girlfriends, and you're going to have all of these different things that happen to you in your life, and figuring out, okay, so in 10 years or in 8 years, what is my goal? And then figuring out how to stick with that. That's probably the hardest thing is really making positive decisions about your education and sticking through that. So that's the biggest challenge. And then I'll just, on a personal note, I was in a really severe car accident while I was in pharmacy school. And I almost wasn't able to complete, but I was able to take classes remotely from the hospital and do a lot of different things to push through. So yeah, challenges come, but that's where we find out what we're made of, and we get a chance to learn and grow through that.
So true, and I'm very glad that you overcame those
Yes.
challenges that were placed in your path.
Thank you.
Some students may be wondering, maybe if I'm a little squeamish about things and I don't want to be around trauma, like, an emergency room surgeon, do pharmacists face traumatic events?
Not all pharmacists, but sometimes, right? I mean, even your pharmacist at a CVS or something, they have to be CPR certified. And if there is an emergency in the building, you are the only healthcare provider in the building, right? And so there's a certain degree of training that every pharmacist is going to need to have in order to respond to something happening randomly, right? If you give a vaccination at CVS and somebody has a reaction to that vaccine, you're the one that's going to handle that, right? And all of that is included in your training to empower you that even if you don't feel comfortable with that right now, by the time you're done, you will feel comfortable and you'll be prepared for that. But there are pharmacists that work from an office, right? So there's such a thing as like a drug information pharmacist. And so when there's these brand new drugs, like with COVID, right? We've heard all about all of these medicines that might or might not work for COVID. Well, there are teams of drug information pharmacists that work in an office, that work in a desk, that don't see patients, but they go through all the clinical trial data and all the literature, and they read about all of the updates from scientists all around the world, and then they compile information about how and when to use which medicine for COVID, right? So there are jobs that a pharmacist can have, even if you don't want to interact with patients and if you don't want anything to do with the direct patient care.
All righty. Now, to be mindful of our time, if I see a question like, how does your profession impact people's lives, that I believe we've probably already answered up to this point, I'm going to skip right over that one. Go into the next one, which, what is least satisfying about the career?
I think the least satisfying is the general public doesn't always know what a pharmacist does. And so they do come to a place like a CVS or a Walgreens and they want their medication in 5 minutes and they don't understand why it's 20 minutes to fill the prescription. But I've explained that tonight, right? That all the different things the pharmacist is doing behind the scenes, that's up here. And so that's probably the least satisfying, is the fact that you continuously have to explain that to the public.
Yep. Good answer. Because you're like, well, aren't the pills back there in a barrel or something? Aren't you just, you'd read it and put them in? No, way more detailed
Yes.
than that. All right, well, the flip side, what's the most satisfying about your career?
I think the most satisfying is the patient impact. We really are making a huge difference to people who are really sick. I have an entire wall in my office of thank you cards from patients who I identified, toxicity of their medicine and side effects, or, to a patient who I helped her with understanding the medications around her husband's death when he was dying and having to take a lot of extra medications for his comfort. I think back on each of those and I think for sure that is the most rewarding part of the career, is the impact that we're making.
Absolutely. Tell us, I mean, you've mentioned COVID a couple times, but tell us, how has this profession changed in response to the pandemic?
I think that everyone is realizing, how critical the pharmacist is, because especially when we have these drugs that, there's some evidence it might work, or there's, a very small amount of data coming out of one country where they use this other new drug, and in figuring out, who's going to know the best about those medications. And almost 100% of the time it's the pharmacist. And so I think that we have really been front line for making sure that the right medications are being used, and also the vaccination efforts. So pharmacies are going to be the number one place that people are able to get a COVID vaccine. And so as soon as that becomes widely available at all pharmacies, pharmacists are going to be, front line for making sure our country is protected.
Absolutely. And I hope that happens sooner rather than later.
Yes.
Because we could really get this vaccination schedule figured out around here. What classes would you suggest taking in high school to help you prepare for a career in pharmacy?
The obvious ones are chemistry, biology. Also, don't shy away from math. Pharmacists do a ton of calculations on a regular basis, based on your lab values and your body weight and a lot of different things. We do calculations to figure out the right dosage or how to change those doses. So yeah, anything in the biology, chemistry. I would say speech class, if, for something a little bit different, because you do a lot of talking to physicians and other people, and the ability to communicate effectively to a physician 1 minute and then turn around into a patient the next minute is really important. So a speech class, I think, was really helpful to me in high school and undergrad.
Right. It's when you're talking with a patient, it's not just you're handing them a slip of paper and said, here's the drug interactions, read it, let me know if you've got any questions, and then see you later.
Yes,
You
yeah.
have to have some in-depth conversations there for sure. What college did you go to?
I went to Kennesaw State University in Georgia. So it's in the Atlanta area in Georgia. And then I went to pharmacy school at LECOM. I was part of the inaugural class. So the very first class of pharmacists in the Bradenton campus at LECOM. I was a graduating student from there. And then I went and practiced for about 5 years in my community. I was a pharmacy manager for Target for several years. And then I came back to teach at LECOM about 6 years ago.
And because everybody wants to know, what's the atmosphere like at college and then at pharmacy school? Is it just study, 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 or do you get to have a life?
No, you do get to have a life. I mean, I think with any doctoral program, the difference from college is that within the doctoral programs, you take almost all your classes together in pharmacy school. So like, let's put it in perspective. Right now, you guys have classes, right? That you go in the morning, you have math, and then you go to biology or whatever. And you have a couple maybe electives or different classes depending on, if you're going to take calculus or geometry, right? When you get to college, you get to pick all your own classes and your own schedule. And so you may not have a single class with the same people. All of your classes might be with different students or collections of students, right? Because you get to pick every single class and every day and time that you want to go to class. And then when you get to graduate school, so like a pharmacy school, we accept, like 120 students into each class. And then those same 120 students take, pharmacotherapeutics, and they take medicinal chemistry, and they take pharmacology, but they all take that course. Okay. Because there's requirements to get that doctorate degree of the courses that you have to take. And so that's probably the biggest difference, is the change in structure. But the great thing about that in graduate school is that you have 120 people that you get to know super well for 4 years. And so they're going to end up being some of your best friends that you will have your entire life. And it really is a huge bonding experience, and they become like family to you, and you have a lot of involvement in the community and opportunities for organizations to go out and do health fairs, and also some fun time, right? Pharmacists have fun too.
Well, you sure seem like a lot of fun, so I believe that. Now, you said you have a doctorate degree, so we've got 4 years of undergrad, and then 2 years master, 2 years doctorate. So you're looking at 8 years total. What are we talking about?
Yeah, so most of our students end up with 8-year degrees. So most of them do 4 years undergrad to get their bachelor's, and then they come in and do a 4-year doctorate. So there is no like intermediate 6-year master's element. I used to joke that if I leave undergrad and go to pharmacy school, I'm going for it, because I got to make it through the next 4 years to get that doctorate degree. But they have now made the prerequisites for pharmacy school a little bit different. And so if you really start early on when you first go to college and knowing that you want to pursue pharmacy, you can get all of those prereqs done in 2 years, guys. So you can actually get them all done in your first 2 years of college and then go straight to pharmacy school. So it's now possible to get a doctorate degree in pharmacy in as little as 6 years. Wow. And in some places, there are schools that have almost like feeder programs where you can do 2 years of undergrad and then 3 years of the doctorate degree and go year round and be done in 5 years with a doctorate degree. It's pretty amazing.
Well, that's fantastic. And that's also a good plug for do your research now, do your exploring, figure out if this is what you want to do. And you could do it in 5 years instead of 8 years. Now, everybody always keeps learning as health professionals, and that's usually done through continuing education classes. Do you have to do CE credits? Do you have to recertify or renew your license?
Yes, we renew our license every 2 years. So every odd year you have to renew. You do have to have, it's different for different states now, okay? Because there's state licenses. In Florida, you have to have 24 hours of continuing education every renewal. And then you have to have specific hours with things like medication errors, things like HIV, the opioid epidemic that is plaguing our country. So you have to have specific categories also in addition to your 24 hours. And then I have 2 licenses as a pharmacist. I'm also a consultant pharmacist. And so that's an additional separate license. And so I have to have an additional 30 hours every 2 years for my consultant license. So yes, there is definitely some continuing education. So probably, an hour or 2 every other week that is required to maintain your knowledge.
And of course, there's always going to be new medications to treat new diseases, new ways to do things, new protocols. Always going to be learning for sure.
Mhm.
So, how did you pay for your education?
I took out student loans. One thing that I did that really helped me was I worked 2 jobs in undergrad. So I earned good grades and got scholarships. And so I got through my undergrad with 0 loans, which was hugely helpful because if you start pharmacy school and you already have a ton of student debt, that's not a great situation to be in. Um, Pharmacy school is going to be, $25,000 a year at a minimum, probably, for tuition. And so you're looking at 100 grand just for the tuition, not including living expenses and books and all the other stuff. So I took out student loans. I would encourage you to talk to people about how to do that safely without getting yourself in a bind, because student loans are a huge issue these days. And you want to make sure that you're being smart about that and not just signing a bunch of papers without advice and guidance from people who know about how to do that successfully.
And I'm glad you explained that, because so many students think, loan, that's a 4-letter dirty word out there. And we don't want to get a loan, or if I get a loan, how in the heck will I ever pay it off? Well, as you described, the salary that you will make after you graduate is going to be a wonderful salary, and you can pay back that loan, a little bit of a time. It isn't going to put you under. You aren't going to be necessarily swallowed in debt forever. It's totally manageable. And millions of students do it all the time out there, unless you just happen to be lucky and have a money tree growing in the backyard, which I haven't figured out how to get one of those to grow yet. I wish I did. I want to switch for just a second here. I want to bring up a discussion question that Dr. Reinhardt had created. There are so many different specialties, as Dr. Reinhardt has alluded to. So this is your chance to chime in. I've got the list up here of the different pharmacy specialties. I want you to put in the chat which one that you want to hear about the most. We're going to see what we get here. So go ahead and type into chat, which one of these specialties within Pharmacist would you like to hear about? We'll see what comes up in the chat. We'll make this a democratic process, and we'll pick the one that we see the most. And remember, you can always go out and do Google search on these different specialties.
Oh, I see a lot of different options here. So pediatric toxicology is a big one that you guys are interested in. I'll start with that. So toxicology pharmacists have a really fun role. There are patients that present to the hospital all the time with random symptoms, and the patient may not be in their right mind or be able to communicate effectively. They might present like they're confused, or they might be unconscious, right? And so they have to figure out, okay, so what happened? Was he exposed to something? Did he, take too much of a medication? Was he poisoned in some way with some sort of chemical? We don't know any of those things when the patient presents and is confused or has these really unusual symptoms. And so there are toxicology pharmacists that look at symptom presentation, that look at the blood work that's drawn from these patients, and you can basically use your drug knowledge to figure out, what type of poisoning the patient has suffered, or, what type of substance was probably ingested, and therefore how to counteract that, or what the antidote to that poisoning situation is. So like, for example, you guys may have, family members that do lawn care, or, people that have lawn guys come out to your house to cut your grass and do your bushes and all those things. And so they use a variety of pesticides on those. And if you have patients that are around those pesticides and those chemicals a lot, and if too much of it gets on their skin, it can actually absorb to a degree and cause mental status changes and confusion and a variety of different symptoms. And so then they'll end up in the hospital, and the toxicology pharmacist helps to figure out what type of pesticide it was, and therefore what the antidote treatment should be for that patient. So lots of different options for a toxicology pharmacist, even working for poison control. You guys might know when you will look at a bottle of cleaner, or different things on the back of the bottle, it'll say like, if ingested, do this, or if you get in your eyes, here's what to do if you get this chemical in your eyes. And even from science class, you might be familiar with like your MSDS, like your list of different chemicals and what to do and how to handle that. Well, there's pharmacists that work at poison control that help to figure out all of that information and create those documents. And when you call poison control, it's very common that you might end up talking to a pharmacist. So that's what a toxicology pharmacist does. I think oncology pharmacist I see also, and pediatric or cardio. So oncology pharmacists are really cool. Oncology pharmacists work at almost every major hospital. So we know that cancer is one of the, the different cancers are huge leading causes of death throughout the United States. Every one of you on here probably knows somebody at some point that got cancer, or has battled cancer. And so chemotherapy are medications, and chemotherapy is usually given either by mouth or in an IV to help fight those cancer cells and to kill off those cancer cells. And chemotherapy in itself is toxic. We think about a cancer patient, we think about their hair is gone, they might be very sick, very tired, they might be vomiting a lot or have a lot of nausea. And so pharmacists work with the patient to figure out, okay, so exactly what chemotherapy agent is necessary for this type of cancer? What are the odds that that chemotherapy drug is actually going to work for that cancer? What dose of chemotherapy should the patient get? And at what point are the side effects so bad that we have to stop the chemotherapy or pause the chemotherapy? And so pharmacists do all of that on the backside. So if you've had somebody in your family or in your community that's gotten cancer and gotten chemotherapy, a pharmacist is making that chemotherapy, and a pharmacist is deciding the dose of that chemotherapy, and the pharmacist is doing all of that behind the scenes, and you may never even meet them. But that's what a chemo or an oncology pharmacist does. Do we have time for one more? Oh, you're muted, Joan?
We do. Let's do the pediatric.
Okay. Pediatric pharmacists are a very special type of people. Pediatrics get sick. Pediatric is kids, right? So pediatrician, pediatrics, and kids get sick, and kids need medications, and kids end up in the hospital with a variety of different, illnesses or conditions. And so they have very special needs for medications. So the way that your liver and your kidneys and your heart and all of your organs work when you're a child are much different than how they work when you're an adult. And so if an 8-year-old takes a dose of a medicine, it might go through their body super fast, and by the next day, there's not even any medicine in there, or it might do the opposite, right? So they might actually absorb too much medication sometimes from the stomach. And so a pediatric pharmacist is the one that can identify, if an adult takes this medicine, then we have this effect, but in a child, it's going to be much different. So like, you can think about even something that you rub on the skin, Okay, so like think you get bit by a bee or stung, an ant bite or something, and your mom or dad or your teacher might help, put on some like hydrocortisone cream or something to help stop that itching, right? Well, a young child, a baby, an infant is going to absorb like 2 or 3 times as much medication as a mom or a dad will. And so all of those dose changes and all of the safety data about whether or not they can even use that medicine, that's what a pediatric pharmacist does. They dose all of those medications for those babies based on how the body works differently in children.
Wonderful. Thank you. Now, everybody's got the list up there. You've had time. You could write down any of the others you're interested in, and you can always go out and do a Google search. But right now, since we've got about 5 minutes left, I'm going to give you a chance to ask any questions that maybe we haven't covered yet tonight. Now, feel free to unmute yourself and ask Dr. Reinhardt face-to-face, or type a question in the chat field. Going to give you a few minutes to type in any questions you may have or unmute yourself. This is your chance.
Is it worth it? Oh, Tyson's asking a good question. Is it worth it? So I would do it all over again because I love what I do. And the best thing about being a pharmacist, guys, if you decide that you're like, well, it turns out I don't really love this, right? Like you get a pharmacy degree and then you go to work at Walgreens and you're like, I'm exhausted. And these people, the general public, are rude and I don't want to work with them, right? Like if you decide that you hate it, then you can just do a different type of pharmacy, right? So you still have your degree and then you can just go and like do some additional training and learn about this other area of pharmacy, and you can switch it up and your world is going to be totally different. It's a new ball game now. So I think it's definitely worth it. I would do it the same way all over again. And I've held multiple different types of pharmacy roles. And so, yeah, I think definitely it's worth it, but it's definitely not something that you want to get into just for the money, because if you just do this job for the money and that's it, you're going to hate it. You got to love helping people. You got to love science. You got to love figuring out the best solutions for things. So yeah, I do think that it's worth it.
Now, some of the questions I see in here, we already answered. So let me pick one that we didn't answer. Let's see, what was your favorite subject in school?
My favorite subject was probably biology. I'm not a huge chemistry person, if you can believe it. So Camille Schreier, Miss America, is obviously like a huge chemistry love, right? I'm more interested in what's going to happen to my body when I put this medicine in my body. And so it's more the biology piece. You got to do both for pharmacy, but I love the biology piece the more. And then I also see a question, do I like teaching more than the actual working in the setting of pharmacy? It's so hard. I love teaching, guys. That is like, I love it. I get so excited. And in the classroom, I'm like energy level 9 out of 10 most of the time. So I love teaching, but I love teaching because it is a topic and a profession that I love and enjoy doing. And I think that's why I'm good at teaching. So I do love both. Working in the profession of pharmacy, I love also, but I have found a way to do both successfully at the same time. So when I go see patients and when I work with my paramedics and my EMS team, I take students with me. And the whole time while I'm doing my patient assessment and counseling my patient, I'm asking my student questions and I'm quizzing my student, and I'm doing both. So I get to do patient care and teaching at the same time.
One final question for you. Let me see here. Let's see, what is the good one that I want to ask? Can you tell us something that you have experienced while working, whether it be teaching or working with the paramedics or anywhere along your path, that has stuck with you all along? Something you learned that has stuck with you all along?
Something that has stuck with me all along. I think, I guess I just keep going back to the impact that we make. And, I don't know how to, say this, but just give you some examples. When I was pregnant and when my daughter was born, I had a patient hand knit a blanket for her, embroidered with her name, because that patient was so grateful for what I had done for her. I had a patient who, um, she was writing out her will and she left a pair of gold earrings to me because I was just like a daughter to her with how much I was looking out for her on a regular basis, right? And so like those moments where you just think like you're just somebody that helps and answers their questions and looks out and checks off to see if there's drug interactions and teaches them how to use their medicine and is there if they need to ask you something, but you make a big difference. So I think those are the pieces that stick with you in again, part of why I love this profession, because you're helping people to improve their own health.
It must be very fulfilling to know that you've helped so many people throughout the years. Must make you feel really good inside, for
It
sure.
does. Yeah, it does. This is a really good way to end this, by the way.
It is. I couldn't have planned this better myself. I want to know all of the students to let you know that in the chat field, I just posted a reminder that the next chat will be held on the first Wednesday of April, which is April 7th, 6:30. I'll be sending out reminders to your teachers and letting you know who we have booked for that. I do have booked, and we always keep our fingers crossed that they can actually make it. But health professionals, things pop up. But the person we have coming around for April is from Blake Medical Center. She's a trauma nurse coordinator. She's also their outreach coordinator. So that's what's going to be going on in April. And before you leave, I've got a final poll for you. I would like to know what you thought about this career chat. So I'm launching the poll right now. It's our evaluation poll. Please take just a couple of minutes to fill out. There's only 5 questions. Only 5 questions on what you thought about this career chat tonight. So I'll leave that poll up if you could please answer that. And in the meantime, feel free to log off after you fill out that evaluation, or if you'd like to unmute and ask a question, please feel free. I see a bunch of thank yous coming up in the chat. Thank you all for listening in. I hope you learned a lot of good information, and you'll go out and do some more Google research, because it's good to figure out now what you want to be than trying to stumble through it by the time you get to college. All right, looks like everybody's answered the evaluations. Thank you so much for doing that. Thank you for joining us tonight. Dr. Reinhardt, we sure do appreciate the time that you gave us tonight and all the wonderful information you shared. Thank you so much for helping us out.
Oh, thank you for having me. I had fun tonight.
Wonderful. Good night, everybody. Take care.